Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Khalil Ekolona, and this is Nashville. Our physical health is one of the most important factors in our lives. It's something that we should be monitoring at all times. Yes, get sick. We may even suffer injuries and illness that require serious medical attention. So what do you do when you're talking with a doctor or medical profession about whatever you're going through? How can you advocate for yourself or your loved one or friends? How can you ensure that medical professionals are listening to you? Dr. Divya Shroff has heard these types of questions before. She has experience to help you become better informed. She served as the Chief Medical Officer of TriStar Centennial Medical Center in Nashville. She has expert-level understanding of how our medical system works. So we've invited her to be here with us today to hear from you because it's your turn to talk. If you have a question about how to better advocate for yourself, how to make sure doctors and medical staff are listening to you, or how to navigate the Byzantine medical system, give us a call at 615-760-2000. Again, that's 615-760-2000. Now, I want to make it clear that Dr. Divya is not here to give medical advice. So if you want answers about that rash or a pain in your arm, seek medical help. Today, Dr. Divya is helping us to become better advocates and communicators. So allow me to introduce Dr. Divya Shroff to This Is Nashville. Welcome, doctor.
Thank you.
Thank you so much for being here. Okay, so I got to ask you this. You were the chief medical officer of one of the largest hospitals in Tennessee, TriStar Centennial, for many, many years. Tell us this. What does a chief medical officer do?
I like to teasingly say it's being the principal of about 2,000 medical staff professionals every day. And by that, I mean, you're really looking at how this cohesive family of doctors, nurse practitioners, CRNAs, all are able to perform at the best of their skill set, right? And so when you have a hospital that's 800 beds, you need an entire team to be focused on getting the best care for a patient, you in this scenario. How does everyone work well together? Where do you put quality top of mind? Where do you think about everyone practicing to the full scope of their license? And so a chief medical officer is really thinking about quality, safety, risk, compliance. How do we deliver the best patient care?
I imagine communication is a primary requirement for a chief medical officer. How important is it when communicating with the people who are under your charge that you expressed, talk to your patients, understand your patients, where they're coming from? How often did you do that?
All the time. And I think there's so many nuances to it, right? So there's, as a chief medical officer, or I think anyone in leadership, right? You have to be able to share a vision, share a message, and communicate, and hopefully inspire, whether it doesn't even have to be a physician. It's the person delivering the tray to your bedside, or someone from EVS who's cleaning the room, right? How do you inspire someone on what their mission and their purpose is, of why they walk into that hall, into that room every day, and how to deliver the best part? And to your point, you never realize what someone's going through in their healthcare journey when they're sitting at that bed. And so it is that often you need to remember, whether it's that verbal communication, it's that body language, it's how do you help someone? Because when people are in a hospital, that's typically when they're their most vulnerable.
Mm-hmm. That's true. All right. Remember, everyone, it's your turn to talk. So give us a call at 615-760-2000, 615-760-2000. So, Dr. Divya, you left the role last year, and you told us recently that your dream is to start the car talk for healthcare. Tell us what that means.
So I'm going to totally out myself as a NPR geek of a certain era who loved car talk. And I will share with you, when I tell this story to others who remember car talk and click and clack, the first thing that I think people happens is they get a smile on their face. And I think about those two individuals and how they created just a commodity of how people think about something as how do you take care of your car? But it's not just your car, right? It's this connection, this humanity, this humor. And what I have found in my professional role, I've been in healthcare for over 25 years, is there are lots of parts of the system that are broken. There are a lot of individuals who don't have the healthcare literacy or access to navigate the system, even though there are so many of us who are trying to improve it and make it not as broken or confusing, but they don't. And so I think a part that's always resonated with me is when you would call and talk to Car Talk and tell them about the noise your car was making, they were able to, one, provide humor and joy on trying to solve a problem.
Mm-hmm.
And I think there's a part of me that thinks that, at least for what resonates with me, is how do you do the same thing with healthcare? And so, you giving me the opportunity to talk here to help people think about how do they better advocate for themselves or navigate a confusing system. And if it can be done in a joyful way, or with compassion and understanding, how well could healthcare be?
All right. Yes, it's that interactive work that Click and Clack brought that all of us loved, and hopefully with this medical car talk, we can do something similar. Okay, so give me this. What's an example of a question that you get asked about navigating the medical system from people?
I mean, there's simple ones, right? Like, how do I know who I should go to for a problem, right? And they're not asking, I'm an internal medicine doctor, but I'll be honest, I stepped away from the bedside 15 years ago. So it's not that, hey, Divya, or, I've got this, like you said, rash. It's more about, well, should I see a dermatologist? What are the questions I should ask? Could my primary care doctor help me answer those questions? Wait, I don't understand if I have to pay X amount in a copay. Where's the best use of my dollars? Is it something that I want to go sit in an emergency room for, or could I just go to an urgent care? Right? Everyone's strapped for time. Everyone's trying to be strategic on how they spend their healthcare dollars. Those are a lot of the questions I get. And those are from friends and family.
And that's what I was about to say. I imagine you fielded a lot of questions from friends and family about how to navigate the system due to your experience and expertise. All right, we're going to start off with a voice message that we got from a caller. Let's listen.
Hi, this is Eliana calling from Nashville. I've heard that the OB you have appointments with is often not the OB who happens to be on call when a person is in labor. So based on that, I'm wondering how important that relationship is, and if it makes sense to consider switching if you feel like the appointments are a bit rushed.
What do you think about that, doctor?
I think it's a great question. And here's the things I would say. So I'm assuming our caller is thinking, because they specifically said OB, it's about the pregnancy component and having a baby. I think the first thing I would advise anybody is it's so important to have alignment with the practice you're part of, right? And so I think it's good to inform yourself and ask good questions right at that first visit. The reality, and one of the things I would say, before I answer your question, is I think why I like the idea of the car talk is I want, doctors are humans who want to do good things. Patients are humans who want to get the best care. How do we kind of create a bridge or a gap? A bridge instead of a gap is kind of the passion on this. Mm-hmm. So in this case, right, if for this individual, I would say, as you look around and, whether if you're fortunate to have the internet, start to understand how does this practice set up, right? Is this practice set up of, if you hypothetically want, a doctor of a certain gender, are they, in their philosophy, are they trying to create that work-life balance that in order for them to be engaged practicing, let's say, female physicians who also want to be present, that's the why they're not on call 24/7, right? Which is a true concern. Okay, if that's the model that they're operating under, okay, do you care for maybe not just the individual physician, but do you like the group? Does it have advanced practitioners? Do they have midwives? Better understand how the practice is set up And what are their missions and values? And does it fit with your philosophy? If it doesn't, and you say, well, no, I really want the person that I'm seeing in the entire 9 months of my pregnancy to be the same person, that I will be honest, I think it's going to be a little harder in this day and age where everybody is trying to find their personal professional balance, but that doesn't mean those doctors aren't out there. And you just got to advocate for yourself and know what are your value systems. The other thing I would say is is finite, right? And in some ways, that's the beauty of a pregnancy. You could start a relationship and go, you know what, this isn't what I thought it was going to be. And so, I mean, that's a little harder to do. I think leveraging community, leveraging resources of just talking to people to better understand what you want is also a great way to figure out, do you want to do a home birth situation? Do you want to have a tub birth? All those things that you could start thinking about.
Okay. All right. The phones are lighting up. We're going to go to Mike in South Nashville. Mike, thank you for calling. What is your comment or question, my friend?
Hey, thank you so much. Yeah, I wanted to make a comment. In talking about finding the right doctors and everything, I think another aspect that we as consumers need to consider is if you've got somebody that's in the hospital long term, or something's happened, they're going to have to be there long term. The importance of working with the physician team and having somebody there to kind of advocate on that person's behalf, especially if they're, in a sedated state or a coma-like state or something like that. I had that happen a couple of years ago with a family member, and it was, we had to really be all hands on deck because, despite certainly the doctors, best efforts and the staff, humans are humans and people can miss certain things. I think the doctor touched on before, the importance of even having, the tech or whoever, having a type of attitude, when they're working with people. It's just really important to have someone there. So I wanted to stress that and make sure folks are, aware that, yes, we want to trust people that are in the hospital, with those that are there, the professionals, and certainly, they've gone to school, they've done all the work, and we believe that they, are going to do their best. But at the end of the day, everybody's human, people have blind spots, and it's really necessary to have someone there that's going to, look out for that patient that may be voiceless at that time.
Thank you. Thank you for your call, Mike. Really appreciate that. Dr. Divya, as I think about this, elderly patients, even people under duress, sometimes can't retain all the information that they need. So it is important to have someone there. How can folks, if you're in a situation like that, how can you advocate for yourself that you would like someone there? Do hospitals provide advocates for those who come into the hospital alone?
Yeah, I think there's a couple things I would say. One, I really appreciate what the caller had to say. I think especially in this day and age where I think time is a commodity for everybody, and that's whether you're on the receiving side of healthcare or the delivery side. And when it's your loved one, family member in that scenario, you want to be present, you want to be intentional. And I would share with you, a healthcare team should and want that, right? Because it is a collaborative effort of working together. What I would suggest in the scenario, and it sounds like hopefully, this individual did, is recognizing that if somebody's there for a long time, if they can't self-advocate, how do you collaborate with your healthcare team well? And so a great example, especially in an ICU setting, is to say, especially if you have a large family, and in this day and age, people are from out of town, and you've got FaceTime and all that, it's always great to appoint one family member to sort of be the lead, one or two, because then you're sharing with your healthcare team that, hey, we recognize that you cannot call every child or, every parent member. And, just kind of create that component where then that becomes sort of the spokesperson for the family. Mm-hmm. So that's one way so that way you can start to create that bond of trust and say, hey, I noticed something that I feel like you didn't speak to, or may have missed, right? So that self-advocacy, there becomes a trust between that individual and whoever of the healthcare team, where then there's that consistency of communication relationship, even if the healthcare team members turn over. To your question, Chloe, I think, one, people may not be aware of this, but in every hospital, there is, number one, a quality department that is always looking to ensure that patients are getting the care that they need. And one part of a quality department is, and this is a standard for every hospital, is having a patient advocate or a patient advocate department. And that is there where, whether it's a individual who doesn't have access to other friends or family to be their advocate, they can always call and ask for the patient advocate to represent them. Patients have rights. They also have responsibilities, right? So every hospital has rights and responsibilities, and part of your rights is having access to an advocate.
I understand what you're saying about having a family member there and using those resources. Recently, within the past year, I was at the hospital there for my mother who was receiving care. When the doctors and medical professionals came into the room, I got on the call with my younger sister, who happens to have a degree in neuroscience. She did all the technical talk. I was getting the factual information things to share with the other family members. We have a very long WhatsApp text thread that is only getting longer these days. But if you're tuning in, this is Nashville, and I'm your host, Khalil Lekalona. It's your turn to talk, and we're talking about how you can become a better advocate when talking with medical professionals. My guest is Dr. Divya Shroff. You can call and talk with Dr. Shroff at 615-760-2000. That's 615-760-2000. We're going to go to Nick in Donaldson. Nick, thank you for calling, my friend. What's your comment?
Hey, guys. Thanks for doing this segment, first of all. So I have worked in the music business for about 10 years, and I've moved all over the place. And I've just sort of struggled to get consistent care that's affordable, accessible, and I've kind of had a couple of bad experiences with doctors that just haven't really seemed to care. Do you have any suggestions or advice for, when you move around so much, finding just a consistent thread of care that you can rely on?
Oh, Nick,
Yeah.
we lost you, but doctor, give him an answer.
So I think this is one place where I think technology is actually becoming more and more is it helping, right? So I'm assuming, Nick, you're a country music artist based here in Nashville who has to travel. There are organizations that are now investing in what I'd call telemedicine. So where you can, with either if you do find a doctor you like, saying, well, let's set up the parameters where, because I do travel, how can I work with you better with your nurse practitioner? Do you do virtual clinics or things like that? If that's something that you have access to from technology standpoint. So that might be something where you're not having a doctor shop in every city you're in, but you're finding a way to find an individual who is somewhat meshing with your lifestyle, but you're getting them the consistent relationship and care. That might be one avenue to explore. And that's where electronic medical records and a lot of the technology innovations are saying, hey, we can create this environment. And that's one way where the pandemic actually, in some ways, expedited technology that was already existent. But because patients couldn't come into the office from a safety perspective, now that industry is saying, well, we can do this even though you could come into the office again.
Mm-hmm. Nick, was that helpful for you?
That's great. Thank you.
Excellent. Thank you for calling, my friend. All right, everyone, we are going to take a quick break. When we come back, we're going to ask ChatGPT, is it a good source to get medical information? It's your turn to talk, so give us a call, 615-760-2000. We'll be right back.
Funding for This Is Nashville comes from you, our listeners, and Music City Prep Clinic, Nashville-based provider for PrEP and offering comprehensive sexual health services in an environment designed to be safe, professional, and shame-free. Learn more at musiccityprep.org.
I'm Khalil Lekalona, and this is Nashville. We're talking about your health today and how you can become a better advocate for yourself and those you care for when talking with a medical professional. Why? Because sometimes people don't know what to say or ask from a doctor when they're in a medical setting. So we've asked Dr. Divya Shroff to join us and help break down some strategies to help you become a better advocate. So if you have a question or comment, you can give us a call at 615-760-2000. That's 615-760-2000. Now, before we took the break, Dr. Divya, we had a call from Trish in Green Hills. It says this, quote, when you go to a doctor and the answers you get aren't helpful, what do you do next? And for context, her husband has back problems and the first line of treatment didn't help at all. He got another appointment. In the meantime, he's still in a lot of pain. Is there anything they should do, Trish and her husband should do in the meantime?
I think the first part is, right, is you want to circle back, right? If you don't share what's not working with the initial doctor and continue to move around, in my opinion, I think you're going to continue to get frustrated because there's not always one cure. Doctors are humans. They make mistakes. They may have tried something. Not everything is an immediate cure or even the right cure. So my first thought would be, is at minimum, you should call back to that office and share that something hasn't worked. And is there a way to come back in, right? Mm-hmm. And that's obviously if hopefully you had a good connection with the physician and you're frustrated more with the outcome, not the person. If on the other hand, you're not happy with the care you got delivered, that is the beauty of being able to get second opinions, mm-hmm. right? The one thing I would say, though, is when you go in for a second opinion, be transparent. Share what you've done to date. Don't, it's, when we go in and we're like shopping for things and, you want to this isn't a time with your own health to not share the full story, because anybody who is going to help you, they need to know the whole picture. Okay, you had this treatment. Did you finish it? It's okay to be honest. If I didn't like how the medicine worked, or I didn't believe in the doctor, so I only stopped taking the pills after one time. While it may feel like you're hiding something or you're ashamed or or you're going to be judged for it, it's going to help someone form a better picture of understanding you, as well as understanding the problem if they know all the information.
Mm-hmm. All right. So it's 2024, Doc. There's so many ways we can get information. And we're going to play a little game right now with you called Dr. ChatGPT. I'm going to read off a question that we asked ChatGPT, and then you're going to grade its answer. So here's the question. What do you do if you want to see an endocrinologist, but their office tells you need a referral and you don't have a primary care doctor to give a referral? Here's what ChatGPT had to say.
I would first consider visiting a walk-in clinic or urgent care facility. There, I could speak with a healthcare provider who can evaluate my situation and provide the necessary referral. Alternatively, I might look for telehealth services where I could consult with a doctor online. Additionally, checking with my insurance company could provide guidance on how to obtain a referral without a primary care doctor.
All right, Doc. What do you make of that answer?
Not bad. And I do appreciate, doctors for a long time have had Dr. Google. I appreciate you all identifying that Dr. ChatGPT has joined the clinic room.
Yes.
I would say here, I think in this scenario, first and foremost, you should have a PCP, right? I mean, and is the question why you don't have a PCP because there's a shortage in your area, you can't get in, so that was just be an underlying question. I think the second part, the one part I did actually like that Dr. ChatGPT said was about understanding your insurance, right? And understanding how it's set up. Because if you have your insurance benefit set up that you do need a referral, you are paying money to that insurance company. They do have inbuilt navigators that a lot of people don't utilize. And if you to the level that they could or should. And I think that's where sometimes I think the healthcare system and especially physicians, I think they can feel that they are getting the brunt of the patient's frustration, but there is this intermediary that you are giving funding to that should help you navigate the system.
Okay. Thank you, sir. That my producers are letting me know that we lost a call. So if you recently called, please call us back. We will get to you. We're going to go to this next call, somebody who I'm very familiar with. Hey, caller, what do you want to say?
Hello, my son. How are you?
Hi, Mom. How are you? I love you. How's it going?
I want your audience to know how wonderful you are. When I was sick and in the hospital, you were 4.5 hours away from me. You came immediately. You checked out the system and then the problems that I was having. And like you said, you call your sister who has a science degree to get it all together so that you and your other sisters wouldn't all be getting on the doctor at the same time. But I thank God for you because you were wonderful and you orchestrated all of it. And I just want your audience to know that I am blessed to have you as a son.
Well, I'm honored and blessed to have you as a mother. Thank you very much. And, it was my honor and duty to do it along with my sisters. And that's what the favorite child does, right? That's why I'm the favorite.
That's right.
That's right. That's right.
Well, I love you, son.
I love you too,
Bye.
Mom. Bye. Okay. All right. Thank you so much for that call, Miss Olafemi Ekelona. We're going to go to Philip in Ashland City. Philip, thanks for holding, my friend. What is your comment or question?
Well, I had an experience at HCA in the not too distant past. I got concerned over a permissions form I had to sign at one of these specialty Centennial Heart, and at the very end of the paper I had to sign, you have to give permissions. You're signing off that they can. I'm just going to paraphrase here. That they are all to share your healthcare information with whoever is permitted by law, and that goes on to say that includes their associates, organizations they're members of, contractors, subcontractors, and on and on. And furthermore, you give them additional permissions specifically to use any genetic information they come up with. And so I tried to talk to somebody at HCA at Centennial about HIPAA laws and how they apply. And this was prior to the final rule, which your guest knows about. And I ran into an absolute wall. You cannot get a hold of anybody. And furthermore, the people I did get a hold of didn't have a clue what I was even talking about. Not about that final law for HIPAA on who they can and cannot share your PHI with, and so on and so forth.
So if I understand correctly, Philip, you have some issues with the potential of signing away, giving permissions to the HCA, whoever you're working with, to share critical personal information, medical information, and potentially genetic information with other entities. Am I right with that?
And that is correct. And furthermore, HIPAA says, in effect, this is just an honor system. I don't think anybody checks on this. Who holds anybody accountable? But under HIPAA laws, each of those people that HCA can share your PHI with, private health care information, is supposed to exercise the same care that HCA does. And I want to know exactly who enforces that and who assures that. HCA had a data breach. I think it was on or about March of 23.
All right.
And it has changed.
One sec, Philip. I'm going to allow the doctor to attempt to answer your question. We can't speak on specific hospitals or companies, but,
right.
Dr. Thomas, generally, what should patients do if they don't want to sign a disclosure form?
So I think the caller's question is valid and concerning. And that can be applied to all aspects, right? Of where you bank, everywhere. I think data security or cybersecurity, more recently than March of 23, think about what happened just this past summer with the crippling of that data update, that crippled airline industries and all that. So I say that on a high level. I think having healthy skepticism or concerns about your data and how it's shared is valid in the day and age we are with technology. I think to the deeper question about better understanding your consents, I'm not a lawyer, and to your point, I'm not speaking to individual healthcare systems. One, you should always feel empowered to ask questions. it's also, I think part of what I would say, knowing a little bit of what I'm hearing from this caller saying, is when they say something like Centennial Heart, that's actually a patient practice that is that's an office within a healthcare hospital, right? So now, yes, it is a employee practice that is employed by HCA, but it's a different part than the hospital system. And those are the things that I think a lot of people don't realize when they think they're driving up to a hospital that has clinics that are housed there as well as inpatient beds. Is this a private practice that's leasing from there? Is it an employed group? And so how do you understand those things? I mean, that's not, I think that's some of the complexities of healthcare that I think individuals like this caller are frustrated by because they just want to get good care. And so what I would say is, at minimum, when you're being asked to sign a consent, what's the consent for exactly? Who brought it to you? And what exactly they're trying to accomplish? Is it for access to a patient portal? Is it where your labs are going to be stored? Is it regarding a lab test? Is it when someone says genetic information, are you collecting a sample? And is that sample critical to you receiving care? Is it for a research study? I guess I would want to understand a little bit more. And I think anyone should feel it's okay to ask the questions, maybe try to understand what's the genesis behind why they're having you sign this consent. Is it for care? Is it for research? Just get a little bit more if they can.
All right. Thank you for that. Hopefully that was very helpful to you, Philip. We're going to go to Kim in the Gulch. Kim, thanks for calling. What do you want to share with us?
Thank you. I love your show, and this episode's particularly interesting to me. I'm calling about my elderly mother who's often in and out of the hospital in Knoxville, and I'll frequently go to visit and stay with her while she's in the hospital and wait to see the doctor who's on rotations, and very frequently told, they'll be by sometime today. Sometimes they come really early. So I would end up at the hospital sometimes for 12 or 14 hours waiting just for the doctor to stop by. And this kept me from doing things to help her for her home to be ready upon her return. So I wanted to ask how we can advocate to have, a time slot or just awareness of our own time when we have relatives in the hospital who we're advocating for.
That's a good question. Doctor.
I think it's a great question, right? And I think it ties into your mom calling in, Clue, right? Is at the end of the day, whether you have a family member like this caller or you work for your mom, or if it's a friend, right? We all want to have a family member who is our quarterback and advocate. And to, I think, this caller's scenario, they're not just coming to just sit at the bedside. They may be trying to work on things to make the life better at the time of discharge. The first thing I would ask, is there should hopefully be at minimum a whiteboard, whether it's a virtual or a dry erase board, that should be speaking to who's the care team, whether it's the nurse and all that. And with finding out from the nurse or, the care team, what time do you do rounds? Is there a set family round time? Can we, even if that's not part of your vernacular that you do for every patient, how can we work together better? Whether it's, can we set a time? If it's a time where, you can't consistently stick to, is there a way you can give me advance notice of, the morning of? So, okay, today you're doing rounds or you have clinics, so you're going to come by in the afternoon. Great. Well, I'll plan my day. I think in fairness as caller, so much of this is about communication and it's expectation settings. And I think, this is appropriately so why patients or family members do get frustrated with the system. On the same level, I think where physicians need to understand and also communicate better and share, hey, these are my limitations. So where do we meet in the middle? And that would be, and I would say leverage your nursing team because they, can hopefully be that intermediary to help build that bridge. Nurses are so integral to that, how the whole system works.
I do want to ask you about questions after the next break. Thank you so much for giving us a call, Kim. But we're going to go to Maya in Hillsborough, West End. Maya, thank you for holding. What do you want to share with us?
Hi, this is Maya. I just want to say this whole show resonates with me on so many levels. I'm a native who went away And I moved back here after my parents passed in 2020. So I was well aware of the whole, taking care of, a dying parent and all those things. Well, lo and behold, a year later, I noticed a lump, and I wasn't set up with insurance and doctors here yet. So, I'm like, okay, I need to get a mammogram. Well, I go through insurance to be like, who takes new patients? So, I'm making all these phone calls. And then they're like, no, we can't see you till September. I'm like, 9 months from now, this thing is, I can't wait. So for about 3 months, I was just, doing all the things. And finally, I just called St. Thomas Main Hospital and I said, look, just give me any primary care that can see me right away so that they can put in an order. And that's what happened. And, and it went from there. And then, there's just been so many, I agree with what she just said about nurses. I think nurses and pharmacists can give you a lot of information that the doctor may not, have the ability or time. And also the fact that, these people are human. I mean, they work 16 hours. I asked them. And then they are like, yeah, well, sometimes I just have to sleep here. So I'm like, oh, my goodness, you work 16 hours, sleep at your job, and then you have to wake up the next day and, be cheery and empathic and take care of people. I mean, I'm even shocked. I have people on my care team who have cancer themselves. So I don't know what I'm saying, but my point is the primary care thing is harder to find now because more and more people are going into specialty. And when you find your care team that you like, stick with it, but it's a lot of trial and error. I know which radiology places I like to go to. I know which nurse, draws my blood nicely and all those things. So,
and you've developed those relationships. I really appreciate your comment, Maya. As I think about this, Dr. Divya, those relationships that Maya was talking about at the end with the nurse the team that she found and the nurse that she gets used to. But what she said really leads to another question that we have. It's like doctors' visits aren't as long as they used to be. They only last 15 to 20 minutes. How can you develop a good relationship with your doctor given the short amount of time that you have with them when you do get a chance to see them after the very long and Byzantine scheduling process?
I think that's a fair criticism. And I like to think that people are trying to be more intentional, where you're starting to hear in some primary care doctor offices that they will say to you, hey, are you okay if I use a scribe, an automatic scribe, AI, right? When we moved to digital records, people started getting on the computer and you didn't have that eye contact and there was this rush, even more rush for time, even though the underlying why for digital records helps people in the long run. Now, if there's a virtual scribe that can help transcribe, we are hearing that physician saying, wait, I'm kind of getting the joy back in medicine because I can actually develop those connections. And so I think we're going through a transition point where hopefully some of that can happen. That's not a panacea, and I don't know if it's always going to, if it's there yet, but that's what I would hope for. I do also want to share with Maya, and first of all, I hope, Maya, you're getting the care you need, because I can't even imagine the scariness of finding a lump and knowing with the amount of awareness right now, especially with it's a lot of breast cancer awareness in October. Things that I would say, if going back in time, it sounds like you did get the care you finally needed, is leverage things like that. The fact that you found a lump, number one, you were advocating for yourself, but you were trying to figure out how to navigate a system. It was 2020, so I don't know how easy it would have been. But if that was today, go to an urgent care in that scenario. Because at least as an urgent care, they're always connected to a healthcare system, more often than not. And so, where, hey, I found this. You may be trying to be conscientious, saying, am I utilizing resources correctly? But hopefully that urgent care would be connected then to be able to get you in, to at minimum get you a mammogram, or to get you in with a doctor. The second thing is, emergency rooms are there, right? They are that that last mechanism. But in this case, because I would imagine you were worried about a lump continuing to grow in the outcomes, I would say, if that was somebody today, go, don't be your own self-advocate and knock on those doors to get you into the person who will hopefully get you the care you need sooner rather than later.
All right. Thank you for that, doctor. And thank you, Maya, for giving us a call. We're going to take one last break. All right. Now, when we return, we'll keep going to the phones to hear from you. You can ask Dr. Divya Shroff a question about how to become a better advocate in medical situations. Call us at 615-760-2000. We'll be right back. This is Nashville. I'm Khalil Ekalona, and this is Nashville. Today, it's your turn to talk. My guest is Dr. Divya Shroff, former Chief Medical Officer at TriStar Centennial Medical Center. She's been here with us this hour to help answer your questions about how to become a better advocate when talking with medical professionals. You can call and give us your share by dialing 615-760-2000. Now, remember, Dr. Divya is not here to give medical advice, but she can help you become a better communicator when it comes to your health care. Dr. Divya, I want to talk real quick about patient populations, because there's many that feel overlooked or dismissed by doctors. I'm talking about women. I'm talking about Black people. I'm talking about people who are overweight. And there's a long list of others, unfortunately. What can be done? What can one do to better advocate for themselves when they're in situations when seeking medical care? If someone doesn't believe you, I'm in pain, they don't believe you. Maybe due to biases or due to whatever their reasons are.
I think the first part I would say is that's real, right? We know that currently happens today. There is enough data and literature to support that. And I would hope first and foremost to reassure those who feel distrust that there are individuals who are trying to do better and make the system better, whether it's through education, whether it's through advocacy, so don't turn away, please know that you should not take care of yourself because you had a bad outcome or you felt you weren't trusted, because the last thing, when you said at the top of the hour, right? It's our bodies, it's our personal health, it's our mental health. We want you to have access. To your question, I think at the end of the day, it is all about advocacy, right? And so whether you are equipped to say, look, I know myself, this isn't right. Women are a great example. There's been multiple studies that show up when women show up in an emergency room, they don't present with typical chest pain, right? It's not necessarily chest pain that radiates down to the left arm like a guy. And so I think a lot of women, it's been shown, studies feel that they're discounted because, it's just nerves, you're fine, when they're actually having maybe potentially a heart attack. I'm sorry, that's an MI. And so I think the first and foremost is to, even if it's frustrating and you don't feel you're being listened to, try to be calm and centered, or to share that, look, you're not hearing me. If let's say you're being discounted in the ER, you can ask to see somebody else. Can I see a supervisor? Can I see someone else? Remember that patient advocate I talked about? Is there someone who at least you're not trying to be confrontational. You're not trying, I think if people recognize that you're trying to advocate, but you want to do it in a collaborative fashion, you're going to get there, right? It is very easy. And I can tell you, I've been there, and not in healthcare, but we all see red when we're frustrated. Mm-hmm. And those are those moments as we're teaching, mindfulness and how to be, empathetic. I think kindness goes a long way. And if you are able to, whether you're advocating for someone else or yourself, just say, hey, look, let's de-escalate here. How can we come to some mutual understanding? I don't understand. Maybe you don't think my issue is important enough to be in the emergency room right now. So great. What are my avenues? Where should I go? Okay, great. You're not hearing me. Can I tell you why I feel you're not hearing me? I think the more people can share, Now you spoke, I mean, that might help if someone feels that they're being discounted. I do think there's a real scenario where English is not your first language,
Yes.
right? Now, I hope people know that, especially in an emergency situation, there is a lot of technology available and should be utilized to make sure you're having appropriate medical translation. You don't need to rely on a family member. You really shouldn't rely on a family member in that situation. And not because that family member doesn't care about you, but you also don't want them to put in their own inflection and bias, or you really want it to be that it's your voice that's coming through a translator. And thanks to technology, we can do that now where Google Translate alone is available, but there is true medical translation technology in all the hospitals.
All right. Thank you for that, Doctor. Okay, we got a couple calls left. We got Pat in South Nashville. Pat, thanks for calling. What's your comment, my friend?
Dr. Divya, you're doing a wonderful job. I hope this continues with your own show, your own version of Car Talk. My question is, if you have to absolutely positively need to go to the internet for medical advice, and I must confess I do that on a almost daily basis, what sites would you recommend that you can trust?
That's a great question. I think first and foremost, I think any academic institution that has resources out there, you'll find, WebMD is non-academic, but you'll find a lot of resources. Children's hospitals, for example, that Cincinnati Children's will put things out. Mayo Clinic will put things out. Stanford, Vanderbilt University probably does as well. So something that's affiliated with a true medical center, I think, is a great resource. I think the other part I would say is this is that continual conversation that you should have with your team. Like, I don't think any physician today will discount Dr. Google and probably soon to be Dr. ChatGPT. But that's a good conversation you should have with your own provider. Like, what are the resources you and I are both, on the same page on? Like, who do you recommend? Because instead of it being an adversarial conversation of, well, I don't believe you because I found this on the internet, in a way, I would imagine if it's this integrated component where these are resources that I like, I want you to use them. And if you share with someone that that's the type of patient you are, hopefully that leads to then a better understanding of how you two can work together. And then back to Khalil's point, when you have that limited time, it's a productive exam and conversation.
Excellent. Thank you so much for that, Doctor. And thank you, Pat. Okay, we're going to go to David. David in Bordeaux, thank you for calling, my friend. What's your comment or question?
Good afternoon, and thank you for taking my call. I was, as a retired military member and a retired VA employee, my last job was being a whole health coach for the VA, and I was wondering, is that a growing industry for the civilian medical healthcare system? And if so, what do you think whole health coaches could be another form of advocacy for patients who feel like their voice is not being heard or they are not being understood?
All right. Thank you for that, David. Doc, we've got a minute and a half left in the show.
I'm not going to lie, David, you're teaching me something new that I'm going to have to look up because I'm not familiar with a whole health coach. But if what you're calling it to me is the concept of a navigator, I think that's the whole point of what we're doing here. And I would say, I think people need navigation resources, right? And I kind of go back to something I said earlier in the call, is there are inbuilt navigators in healthcare systems, in insurance companies. And so I want to make sure people realize that you're not alone, and you should find resources of people who can help you make sure you're getting the care you deserve and you need.
Excellent. Thank you so much for that. David, you still on the line with us?
Yes, sir, I am.
Okay, the doctor, can you give us a little bit more information? There's about 40 seconds. What a whole health coach does?
Well, for the VA, a whole health coach, we embody the mind, body, and spirit theology of helping people understand the different levels of wellness. we deal with the financial, the spiritual, the exercise components, the nutritional side of things. But in counseling veterans and getting to understand, the things they've been through from a holistic approach, we're able to help steer them and direct them to resources that the VA has for them. And I was hoping that, this was something that can be picked up in the civilian world as well for healthcare professional systems.
That's a great idea. Let's hope it does. Thank you for calling, David. And I want to thank Dr. Divya Shroff for coming onto the show, taking questions from the people, giving them answers. Really appreciate it, Doctor. Thank you so much.
Well, thank you. I hope I was able to help a little bit.
I believe you did. And thanks to you all for tuning in this hour. This is Nashville is a production of Nashville Public Radio. Today's episode was produced by Emily Siner. It was directed by Tasha A.F. Lemley. Our technical director and board operator is Liv Lombardi. Char Daston helped us out by taking care of the phones. The masterminds behind our theme music are Larange and Namir Blade. You can listen back at thisisnashville.org or wherever you get good podcasts. The conversation never ends here. Tweet us at This Is Nashville. Find us on Instagram. Tell us what you want from our show by filling out our quick survey online, or you can even give us a call, 615-751-2500. We may use your message on air. We may not, but we'd love to hear from you regardless. This is Nashville. I'm Khalil Ekalona. We'll see you on Monday, everybody, and be good to each other.